My name is Natasha and I'm 35 years old.
I'm Nicole and 30 years old.
I'm Andrea and I'm 36 years old.
There's limitations I have to this day and they'll go on forever.
I was having about 7 hot flashes a day and 2 night sweats at night.
Some of the side effects that a patient might typically see me for are things such as radiation-induced dermatitis, chemo brain fog, fatigue, lymphedema, hot flashes, and neuropathy. Patients might seek out the care of a naturopathic oncology provider after their treatment because they may have lasting side effects, and they might be looking for other options that they can use to treat those side effects. One of the things that we might do to treat hot flashes is ensure that the patient's intake of caffeine is very low. A lot of patients who are big coffee drinkers or have a lot of black tea or higher caffeine containing teas do have higher incidence of hot flashes. Well, sage tea has very cooling properties. One of the most studied agents, which is glucosamine, seems to reduce the severity of joint pain in patients taking aromatase inhibitors. What I have patients do is I have them brew a very strongly brewed calendula tea and apply that topically to the area where the radiation-induced dermatitis has occurred. So I might have them look for a registered massage therapist or a physical therapist that has extra training in treating lymphedema. And they might teach the patient different techniques that they can even do in the comfort of their own home by themselves. That can make a huge difference in the amount of lymphedema that the patient has. Chemo brain fog is another common complaint from a lot of our patients, and they often complain of not being able to remember things, forgetting why they've gone into a room, unable to keep lists, or just able to keep thoughts straight in their brain. And so we often will refer them to specialized centers where they do chemo brain fog clinics, and that involves retraining the brain. So the most clinical response that we've had with peripheral neuropathy is doing acupuncture protocols combined with a low-intensity laser therapy. This would require going to a specialist to get these treatments done in office.
I was able to find a naturopath that focused in oncological naturopathy, which I found very helpful because it was someone who understood what I was going through.
The side effects I had haven't really affected my quality of life now all that much. Most of them have gone away.
Some patients can bounce back very quickly, especially if they're doing adjunctive care as part of their treatment plan.
Live, laugh, learn.